Hello friends, I am Dr. Vandana. I am a practicing obstetrician at Vasundhara, Ghaziabad. Today we are discussing about a very important topic, preterm labor. Preterm parturition is a syndrome resulting from multiple maternal and fetal factors. Preterm delivery can be either spontaneous or medically indicated due to maternal reasons like high BP, preeclampsia, or increased blood sugar levels, or sometimes fetal reasons like fetal growth restriction. So preterm labor is based on some signs of uterine contractions, cervical opening, that is tightening or dilatation, as well as rupture of the chorioamniotic membranes like gush of the fluid outside the vagina. So neonates born preterm are at increased risk of short-term complications as well as long-term morbidities such as neurodevelopmental disorders and cerebral palsy. Prenatal administration of corticosteroids has lowered the rate of respiratory distress syndrome in neonates, and even surfactant therapy is very good. So the clinical management of women presenting with preterm labor has few goals like prevention and reduction of complications of prematurity in the neonate by administration of corticosteroids, antibiotic treatment to prevent Group B streptococcal infection, and transfer to the patient to a hospital with adequate NICU facilities as needed, and stop the process of premature labor. If that cannot be achieved, at least prolong it enough to allow the administration of corticosteroids and reduce possible neonatal sequelae, and plan the mode of delivery and verify the availability of neonatal intensive care. Despite all these efforts, there is no specific treatment for spontaneous preterm birth due to the syndromic nature of preterm parturition that cannot be resolved by a single medication or intervention. So prevention of preterm birth can be by primary measures, some secondary measures, and tertiary measures. So primary measures can be directed to all women before or during pregnancy to prevent and reduce factors associated with increased risk of preterm delivery, that is lifestyle, environmental factors, smoking status, periodontal diseases. Secondary measures are aimed at eliminating or reducing risk in women with known predisposing factors like previous preterm birth, short cervix at second trimester, and some uterine anomalies of second trimester. Tertiary measures are indicated after the parturition, that is labor process, has been started with a goal of delaying or preventing preterm delivery or improving outcomes for preterm infants, that is administration of corticosteroids, administration of magnesium sulfate to prevent neurological disorders, and also a good NICU facilities. Few interventions for secondary prevention of preterm birth can be there, like administration of 17-hydroxyprogesterone to all women with a history of prior spontaneous preterm birth without a short cervix, or consideration of vaginal progesterone administration to any asymptomatic woman with a short cervix between 16 to 24 weeks of gestation regardless of prior preterm birth due to benefits in preventing preterm birth or any progesterone. Offering of an ultrasound indicated cerclage with a short cervix. So cerclage is like the applying a thread to the mouth of the uterus, that is cervix, that it will prevent preterm labor in patients those who have short cervix. So ultrasound is a very important modality, and consideration of cerclage placement are very much considered in women with a cervical length of less than 15 mm after 16 weeks. And if all because preterm labor has been said and the patient has come to us in our facility with preterm labor, then if it is less than 32 weeks, that is very preterm, very preterm, then preferred mode of delivery should be cesarean section. I hope these knowledgeable points are helpful to you all. Thank you.